All right, we are live. Do our quick audio checks just to make sure we are good. Looks good. All right, we are live. Cool, we're all set. All right, guys, welcome back to the live stream. Actually, my monitor is not set up. Let me set up my monitor real quick. But welcome back to the live stream. We are on day 3. Today's session topics, we're going to be doing section 4 and section 5. So international efforts to advance health informatics practice, and then health information technology principles in science. We always do 1.5 sections per day, so we're going to do just a little bit of HIT principles in science, but mainly focus on international efforts to advance health informatics practice. As usual, what I'm going to do is just try and outline what I think is going to be on the exam, as it's a little stressful to think about because it's like, what exactly should we know about international efforts to advance health informatics practice, right? So it's just kind of a wild goose chase to see what we need to study. Anyways, let's go ahead and get started. We have an hour on the clock. Might start doing less than an hour because I'm finding that this is day 3 and I'm already kind of exhausted. So let's start off with a good Google search today. International efforts to advance informatics. I think HIMSS Tiger is a good example of it, but let's go into that in a little bit. Here's one. There's a couple. So was it international efforts to advance health informatics practice? So there's probably a couple health informatics. Yeah, this thing. So I'm familiar with this. HIMSS has a pretty nice international collaborative to do this. So let's see. Tiger, an initiative for technology and health informatics education, focusing on education reform, interprofessional, community development, and global workforce development. The technology informatics guiding education reform initiative offers tools and resources for learners to advance their skills and for educators to develop valuable curricula. Blah, blah, blah. Yeah, next generation of global healthcare professionals to improve patient care. So they create an environment that maximizes the possibilities of technology toward knowledge development and dissemination, driving rapid implementation of best practices, as well as competency and curriculum development. So they actively engage with global healthcare workforce, students and adult learners to encourage standardized, person-centered, and technology-enabled process workforce development. So there's a lot of different projects that they do. While informatics recommendations on competencies and education support design of courses and curricula, they are unable to inform educators on how to customize content for local needs and requirements. That's why the Tiger International Competency Synthesis Project and the EU-US eHealth Work Project came together to describe and validate the Tiger's initiatives framework of global informatics core competencies for health professionals. These projects compiled a recommendation framework of health competencies to version 2.0 to measure, inform, educate, and advance development of skilled workforce throughout the EU and US and around the world. Yeah, there's a lot. So we'll probably just like list some of these. This is probably good to know. Like, what are some of the international workforces? I just don't know the date on how long they started. This is from, it's their year towards the Tiger. Wish there was a year on this. Oops. Let's see. I don't see a year. 2019. I imagine it's relatively recent. I actually was involved a little bit on this. That's the only reason why I know. But let us actually just start citing this. So, Tiger initiatives. So Tiger is the overarching term used to describe the global initiatives by HIMSS. This is a pretty good one. Let's do that. Let's go ahead and cite Tiger. Nice. And we'll just list a couple of the projects and then this should be good. So this is one of them. I think I cited this, right? No, let's go ahead and cite this now. Tiger International Competency Project. Oh, this is from 2016. Oops. All right, so began comprehensive activities to compile recommended core international informatics competencies reflective of many countries, scientific societies, and research projects. 3 phases: compilation of national case studies submitted by our global committee members from Australia, Brazil, China, Finland, Germany, Ireland, New Zealand, Philippines, such and such. Deployment of a survey composed of 24 areas of core competencies in clinical informatics with 5 domains: clinical nursing, nursing management, quality management, IT management, nursing, coordination of interprofessional care. It's very focused on nursing here. Creation of the recommendation framework, nursing-centric, derived from case studies, survey results, and stakeholder input. This framework was populated with international recommendations for cognitive competencies in nursing aimed at providing a grid to host knowledge about informatics competencies, professional roles, priorities, and practical experience. The EU, funded by the Horizon 2020, joined forces to describe and validate the Tiger's initial framework. So this is the competency synthesis. So let's go ahead and copy and paste this. Cool. Where is the 3 things? Oh, here's the 3. So let's go ahead and tab this. Okay, let's see. Another notable project. Oh, so there is a virtual learning environment for stuff. You know, I think, yeah, we'll just put these in here. We don't need to cite each one of these. Tiger Virtual Learning. CETA provides our global country knowledge leadership international task force. Yeah, I think that should be the main stuff. That was the task force piece. Let's go ahead and paste this. Oops. Virtual learning environment. This would be interesting to explore. I know there's always like, you know, questions about how we can better practice our skills. I wonder if this environment facilitates that in any way. Something to look into. Okay, so Tiger is something important to know. So Tiger initiative from HIMSS. It's good to know. Okay, let's see what other international efforts are there besides these. Health informatics in developing countries. Information technology is an essential tool to improve patient care and quality of care and to reduce healthcare costs. There's a scarcity of large sustainable implementations in developing countries. The objective of this paper is to review the challenges faced by developing countries to achieve sustainable implementations of health informatics and possible ways to address them. Central to the success of any implementation is knowledge of the challenges to be faced. This is even more important in developing countries where uncertainty and instability are common. There are also hope that this article will assist policymakers, healthcare managers. Cool. Does it talk about resources and infrastructure? Health IT agendas. Here we go. A comprehensive nationwide e-health agenda that contemplates most of the challenges we address in this review is vital. The development of health IT has been attracting increasing interest in recent years. The need for health IT applications to better develop and sustain IT projects has been advocated by the United States and other international organizations. Development e-health. These are a little lack of common interoperable standards. This is interesting because this is good to know about the challenges, but it doesn't really fit into this. I'm looking for the solutions, right? That's what we're looking at. International efforts to advance practice. I mean, this is kind of it. There's something, but it's not concrete enough. The AMIA 10 by 10, I think, is definitely one, but I think isn't it just US? Okay, there are some other initiatives. Includes Informatics Training for Global Health Program of the Fogarty International Center, U.S. National Institutes of Health that maintains 8 partnerships between the U.S. and international academic programs to expand informatics training in India, Latin America, and Africa, as well as the AMIA's Global Partnership Program funded by Bill and Melinda Gates Foundation. The goal of promoting project-centric approaches to training in developing countries to expand the local capacity. I just wish it was a little bit more well listed. Maybe I just copy down a couple of these examples. 10 by 10. This is too old. 22. Since such as here. This is too old. Maybe I'm gonna look for something else. Let's try settings and let's search for. I don't think it's this one. Let's search settings, tools. Here we go. Let's do from 2015. Let's try that. Certification, evolution of Tiger, International Medical Informatics Association. They probably are doing something. Future of Nursing, Interprofessional Clinical Informatics. Here's something else too. International Conference on Advanced. Nah, that's not it. International Medical Informatics Association is an independent organization established under Swiss law. 1989. Blah, blah, blah. It evolved from a special interest group to its current status as a fully independent organization, continues to maintain its relationship with IFP as an affiliate, has close ties to the WHO as an NGO and with the International Federation of Health Information Management. AMIA is also a liaison A category organization in cooperation with ISO. It seeks to grow and nurture a collaborative global biomedical and health informatics community that encourages and supports international initiatives. So they probably have something here. So again, international efforts to advance health informatics practice. So what are some of their initiatives here? About Us, task force, strategic plans, work groups and SIGs. This looks like it's part of it. I mean, you can say this is part of it. AMIA working groups to target specific areas. Gonna cite that. Let's go ahead and do this. International efforts to advance health informatics practice. I think I cited this right. Yeah. Yeah. Okay. So they are doing stuff to advance specific areas. Like any like big initiatives. What's NIs? You really shouldn't be using a lot of acronyms. Nursing informatics. I'm not a fan of acronyms. It's opportunity in case focus. No. Maybe task forces. Let's see if this has anything. You know, I don't really hear too much about AMIA. I don't know why. Let me try another search. International efforts. Advanced health informatics. Informatics do how to prepare. Okay, this is not interesting. What's task force? Oh yeah, I mean, I'm assuming task force probably fits more under like an initiative, but doesn't seem like there's any task forces right now. Advancing health informatics. Grand challenges. 4 cities advancing. Yeah, I feel like there's not that much. At least not ones I'm finding. To advance the science of public health informatics. No, these are all like within the US. I don't see a lot of international efforts. Interprofessional clinical informatics. Let's see what this is. Preparing for the future of nursing informatics. Nope. Proceedings in the 3rd International Center. Nope. Let's do the 10 by 10 program. I might have to go back to that one informatics AMIA. Like I'm familiar with this as like a training program to train future health informatics folks, but is there something that expands into international that I thought I saw? 10 by 10 with VA. Is there a international? I don't see one. Informatics over courses. OHSU, UAB, International Informatics. It's like really old. Introduction to the International Medical Informatics. Global role in furthering. The Korean Society, the publisher, is a member of AMIA. Three additional journals. You know, there's not much. I might just cite back that original article that we had. International. Oops. That's not good. International efforts. Where was it? I think it was this one. I guess to my knowledge, it doesn't seem like there's too many. Well, to be honest, like any of those standards development type work is probably international. That's probably the most international type, in the efforts to address international efforts to address or advance informatics. That's probably the most likely to be aligned with that question. Let me go back down here. Health IT agendas, you can say, is one that contemplates most of the challenges we address. Development of health IT agendas has been advocated by in other international organizations. So what I'm going to do is I'm going to cite this and then list some of those other things in here. So creation, development of health IT agendas. And advocated developments, optimal standards, development. Cool. This is probably like decent enough. E-health agendas. And what was the citing for this again? Health informatics in developing countries. It's just a little dated, the information in here. It is common for HIS. I think the most ideal thing to put in here is like the standards work and education work. Let me read this again. It is common for HIS to be fragmented, incomplete, inaccurate, and isolated, and this problem is even more explicit in developing countries. This leads to information silos, and the information contained inside them cannot be used for patient care or data analysis. To overcome this problem, the effective use of standards is of cardinal importance. The ability to exchange and use information between different systems, interoperability, is a fundamental requirement to accomplish healthcare goals. The most important consequence of the lack of interoperability is the loss of the continuity of care among practitioners. The WHO asks its members countries to adopt standards for effective information exchange between healthcare actors and e-health implementations through a resolution in 66 World Assembly. Some of the aspects that need to be addressed to achieve effective are the correct and unambiguous identification of patients, improved cooperation among stakeholders to ensure the consistent application of standards across different domains, use of data interchange standards to ensure syntactic interoperability, and the application of semantic interoperability with the use of standard terminologies and the use of quality measures to ensure that data is accurate and relevant. Most of the standards needed to create interoperable systems exist today and are the same as those required in developed countries. The problem is that different groups select different standards for the same purposes. Government and stakeholders must be aware of these issues and advance methods of reaching consensus on common and consistent use of standards. International initiatives showing the benefits of defined standards could improve and accelerate the process to define these standards in developing regions. In the same way, International Standard Society should help these countries in the process of implementing these interoperability programs, disseminating its standards and training staff. The only thing I saw in terms of like an effort is like we know there's an international effort to implement standards. How long ago is this? 2013. So we can say, let's see, development health IT agendas, like increased adoption of standards. Use their exact wording of common interoperability standards, and we're going to add a site. Why is it taking so long? Come on, Zotero. It's lagging. Oh, I really get annoyed when things are so slow. Well, while it's loading, get some more water. Be right back. No, it's still loading. I think I'm gonna have to restart this. Very annoying. Let's go back down. Okay, where's the stuff? Here it is. It's weird, it's not working now. Let it go. I don't know if it's just like down or something. It's usually not this slow. Let's try this one more time. Let me just close this. Reopen. If this doesn't work, we're just gonna move on because this is taking a little too much time. it's really lagging here. What the heck is going on? Sorry for the technical issues here, folks. Nope. We are going to forego Zotero for today because it's not working. So let's go ahead and just continue building the outline. Okay. Cool. I think the last part of it would be just the training piece. So regional integration. Huh. AMIA, through its working group for development, has focused on this challenge, creating a global repository for all ongoing projects related to health IT, with the hope that it will fulfill the final goal of connecting all the actors working on HI solutions for developing countries. The site is relatively new as it was introduced in July 2013, and managing the input of data by project leaders has proven difficult, mostly due to lack of knowledge of the tool. Efforts to communicate successful programs in the region. This is very interesting. I wonder if that still exists. Was it this one? Oops. I mean, this is kind of what we're looking at too. It's like different projects. 59. Nope. Looks like that project failed. And it's crazy how many efforts go into like building or solving a problem and it just fails. So this was a initiative that failed. It would be interesting to note this though. So what is it? It's a global repository for all ongoing health projects related to health IT. Let me go ahead and paste this. AMIA failed. It's just good to know the history and stuff, you know. So let me go ahead and put some reading in here. Okay, and then the last thing will probably be the training, and then we can probably move on to the next section because we're already at 30 minutes. Let's see. Training. So efforts and training. Workforce development and training. All right. I think I read through some of this, but let's do this one more time. So there's widespread agreement that an appropriately trained workforce is a critical dimension if sustained progress is to be achieved. There are too few well-trained medical informaticians, and they have an inadequate geographic distribution to meet the needs and expertise necessary for health IT implementations. The general model to train the workforce needed emerged from the E-Capacity meeting in Bellagio in 2008. During which components of the educational strategy to train clinical informaticians and improve the level of informatics knowledge, skills, and attitudes in both formally and informally trained health workers were described. Educational programs are emerging around the world. Different degrees of specialization are needed, from graduate education to shorter courses. One example is the American Medical Informatics Association's 10x10 initiative, a program that aimed to train 10,000 professionals in health informatics by 2010. Since its introduction, AMIA has been working alongside local institutions in developing countries such as Argentina and Singapore to create an international version adapted to local needs. Other initiatives include the Informatics Training for Global Health program of the Fogarty International Center, U.S. National Institutes of Health, that maintains 8 partnerships between the United States and international academic programs to expand informatics training in India, Latin America, and Africa, as well as the AMIA's Global Partnership Program, funded by the Bill and Melinda Gates Foundation, with the goals of promoting project-centric approaches to training in developing countries to expand the local capacity to continue programs in the future. Another approach to this problem is the use of telemedicine and mobile devices to connect trained resources with the population in need. Ding, 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 YouTube. It's blows my mind how little access and information exists out there for training. It's a great time to leverage technology to do so. This is especially useful in rural areas located far from urban centers where the specialized workforce tends to live. One example is the experience in India of using mobile tools for the screening of retinopathy. All of these actions are recognized as essential for advancing educational programs and implementing systems in ways that are compatible with local culture and healthcare needs, and should be coordinated with current efforts being made by the International Medical Informatics Association through education working groups. If anyone is interested in doing this kind of work, regardless of what it is, training or not, it seems as though coordinating through International Medical Informatics Association would be very helpful in expanding your impact. Cool. I think that's it for this case. There's a decent amount of efforts, not a little less than I had expected, but perhaps that's not a bad thing because these are large groups that is consolidating all the efforts and initiatives by multiple stakeholders. So maybe that's a good thing. There's a coordination via a quarterback. All right, so let's gonna move on. We're already 37 minutes in, so now let's move to health information technology principles and science, which these terms are so vague. I'm like, which principles, what science? There's so much that you can talk about. I don't even know what they're really referring to. Health information technology principles and science. Health information technology is such a vague, broad, overarching term. Let's see. Principles in science. The importance and use of electronic health records in clinical research. Usability, interoperability, what principles in science? Redefining the roles of health information management and health information technology. Being sought as one of the key elements streamlining the process of providing health care to improve quality and harness costs. It is hoped that HIT will lead to a more cost-efficient healthcare system than the current one. Surprisingly, there is no agreed definition of HIT in academic literature or government documentation. This is from 2009. HITECH defines health information technology as hardware, software, integrated technologies or related licenses, intellectual property, upgrades, or packaged solutions sold as services that are designed for or support the use by healthcare entities or patients for the electronic creation, maintenance, access, and exchange of health information. It could refer to a broad base of information technologies used in healthcare, from robotic surgery to chronic disease home monitoring devices. However, there's a consensus on the purpose of HIT as the use of devices for management of information in order to ensure that it is available to the right person at the right place and time and place. Okay. Core principles. Two goals were listed. I really don't know what they're trying to get at. HIT principles and science. Like, I feel like some of the stuff we already covered in here is like some of the principles. So I don't know what other stuff really needs to be known. HIT that allows for, it is where the HIT further expands the role of the ONC to develop HIT infrastructure. 11 focus areas should lead policy and standards. Principles and science. Maybe this is what we can use here. Adoption of HIT. Yeah, let's go ahead and use this. This is like overarching enough to give a broad sense of what should be achieved. I'm trying Zotero one more time. Redefining the role. So what I'm going to do is copy these focus areas, because this talks about developing HIT infrastructure, and so I think you can kind of apply this to the question, which is HIT principles in science. 11 focus areas. Let's go ahead and copy and paste this. What was it? Kind of a high-tech act. Adoption of HIT infrastructure for high-tech. Dang it, it still doesn't work. That sucks. Let me just copy and paste. Probably would be beneficial to have like links like this versus like what I had before. Yeah, so I mean this covers like privacy and security. This is like medication safety, reducing healthcare costs, appropriate information like CDS, meaningful public input, improving coordination of care. I think this is fine. I mean, there's not. I'll do one more search since we are 42 minutes in. I'll do one more search to see if there's anything else that's beneficial. Here we go. It says mysterious acronyms and confusing job titles are somewhat common in the healthcare field. Recently came across a new to you term that has you curious to learn more. Health information technology. What is health information technology and how does it impact the medical world? Technology is everywhere you look in healthcare facility, from electronically checking in patients and updating the medical records to sending them to the results of a blood draw on their online chart. HIT is the behind the scenes keeping all those systems running smoothly. Whether you're hearing about this health science specialty for the first time or you've heard the term before, might not realize the effect these tech pros have on the healthcare industry. So what is it? Area of healthcare that oversees the technology systems healthcare providers use to manage patient data. Health IT refers to electronic systems healthcare providers and increasingly patients use to store, share, and analyze information, according to the ONC. HIT includes technology like EHRs and e-prescriptions, as well as tech tools that help patients meet health goals. Okay. Importance of health IT, future of health IT. This is fine. I don't think there's any more. Let's see if there's an impact on patient safety. or considered. And maybe this should be one of the focuses: principles and science. Yeah, we'll copy this piece and then we'll call it a day. I mean, these are like the typical tools you think of in the inpatient setting. Let me cite this. Impact. Or like health information technology. Common, what I'm gonna say is like common health information technology in preventing patient harm. Let's go do that, and then I'm gonna copy and paste these things over. Go ahead and link. Okay. I don't really want to paste all the first paragraph stuff. Electronic sign out and handoff tools. Barcode administration. Like these all should all be straightforward stuff that I don't really need to add in more details about, even though I kind of want to. This is like a very pharmacy oriented one, seems like, too. All the technology is used in pharma informatics. Or maybe not, spoke too soon. Retained surgical items prevention technology. I don't even think I've know what those are. What is that referring to? Patient electronic portals. Telemedicine, synchronous telemedicine, remote patient monitoring, electronic incident reporting, overall impact. Yeah, these are all good things to know. All right, I think we are gonna call it. Actually, I was supposed to finish that off last time, but it should be good. Let me see, double check. So section 4 and 5, and then tomorrow's the 10th. So on the 10th, we should be doing these two. We're supposed to be doing these two. 11th and 12th. Okay. So we're set. We're a little bit ahead of schedule. All right, guys, I think we're just going to call it for today. Today's section wasn't like super helpful. The international efforts were a little interesting though, so some benefit there. But in case, if you guys are watching, which I only think, I don't know, 1 or 2 people are watching, but thank you guys for tuning in. If you're catching this on the replay, thanks for tuning in as well. See you guys tomorrow. Bye.